Good morning, everyone. I welcome everyone who is dialed in to our Zoom conference and to everyone who are watching us live on Facebook. I welcome you all to our IAALV online discussion about COVID-19. I'm sure you all already know a lot about COVID-19. You're hearing it on the news and you read about it on the internet day in and day out. But today we're going to discuss more about what is going on in our valley. We have very esteemed doctors and the people here on panel, Mamta and Nitin also. We're going to discuss how they are contributing to the community with yoga and giving back to the community with social service. We're also here to stay fit, stay positive, basically. We're not just going to discuss about COVID-19. We're going to discuss about staying positive, staying, having our children being positive, giving them advices. So let me start off with a song which talks about staying positive. ये हौसला कैसे झुके, ये आरज़ू कैसे रुके, ये हौसला कैसे झुके, ये आरज़ू कैसे रुके, मंजिल मुश्किल तो क्या, धुंधला साहिल तो क्या, तन्हा ये दिल तो क्या, तेरे नाना तेरे नाना तेरे नाना राह पे कांटे बिखरे अगर उस पे तो फिर भी चलना ही है, शाम छुपा ले सूरज मगर रात को एक दिन ढलना ही है, रुत ये टल जाएगी, हिम्मत रंग लाएगी, सुबह फिर आएगी। ओ देवी नाना देवी नाना, ओ ना देवी नाना देवी नाना, ओ ना देवी नाना देवी। ये हौसला कैसे झुके, ये आरज़ू कैसे रुके। होगी हमें तो रहमत अदा, धूप कटेगी साए तले, अपनी खुदा है, अपनी खुदा से है ये दुआ, मंजिल लगा ले हमको गले, ज़ुर्रत सोबार रहे, ऊंचा इकरार रहे, जिंदा हर प्यार रहे। ओ देवी नाना देवी नाना, ओ ना देवी नाना देवी नाना, ओ ना देवी नाना देवी नाना। ये हौसला कैसे झुके, ये आरज़ू कैसे रुके, मंजिल मुश्किल तो क्या, धुंधला साहिल I hope you were all chiming in with me for those 4 lines. Manzil mushkil to kya, dhundla sahil to kya, tanha ye dil to kya. Oh, anyway, I now welcome Vasu Singh, a patron of IAALV. She's also a member of IAALV, a healthcare professional herself, to introduce our guests. And Asha Anil will be introducing Nitin and Mamta. Without much ado, I hand over the mic to Vasu.
Thank you, Anita. And that was the most beautiful song that I've heard. You made our morning. Lovely. So some of you may not know me, and some of my friends definitely know me well. I'm Vasu Singh. I'm a family medicine doctor here locally, and I have been working for a very long time in the area. And I'm privileged to have a special docs and a team with me today. And as you know, that it's very difficult to get hold of some good doctors, but I tried my best. And I have Dr. Muniza Shah. She's a psychiatrist, been practicing here for over 15 years in the Valley, and a very esteemed and a renowned psychiatrist in Lehigh Valley. Very, very difficult to get hold of Dr. Shah. And so she has seen a lot of mental health issues, a lot of impact on community and with different age groups. So I would definitely, we will have a great perspective from Dr. Shah. And then I have Dr. Krupa Danielle. Krupa is, again, she's a very esteemed member of our community here, and she's an infectious diseases specialist, has been working for Lehigh Valley Hospital for, I think, over 5-7 years now. And she works out of the Pocono Medical Center, but she's also, she works out of Cedar Crest as well. So Dr. Daniel has been involved with a lot of very sick patients with COVID in the hospital, in the ICU setting, on the floors in the hospital. So she definitely has much better perspective of what's going on in the hospitals. So Krupa, truly appreciate your time. I know you're very, very busy. So once again, thank you so much. Thank you all. Asha, do you want to take over and introduce Nitin and Mamta, please?
Sure. So I'll start off with Mamta. Mamta has been in the Lehigh Valley. She's an IT entrepreneur. She's been living here for many years with her husband and 2 sons. She's a certified yoga teacher and practices yoga for the last 15 years. Wow, I wish I could do it even one day. It'd be great. And she has, I think she's helped her students remain calm, peaceful, engaged during this COVID times. But she has free yoga sessions she's hosted, and she's also collected donations for the Meals on Wheels of the Lehigh Valley. That's how she's been contributing, and I think we can get some great tips from her about keeping fit and keeping healthy, keeping your mind healthy. The next person I would like to introduce is Mr. Nitin Loud. I've seen him in and around a lot of IAALV organizations, like most of you have done. He has been actually, I think, a prominent member of IAALV from 2002. He and his wife has contributed to IAALV's different programs, and they've been involved with them. He has been the vice president, the executive committee member at large, and he was also on the board of directors. He's been involved in the various community initiatives in the Valley, such as the adult literacy program, the prison computer literacy program. He's been mentoring the Indian American youth associations with their Allentown Rescue Mission volunteering efforts, the food drives. And during this particular pandemic, he has been involved with the Allentown Rescue Mission with the food service, and he'll give you more information of what he's done. He and his wife have donated masks. His wife Neha is a very well-known member of the IAALV. She's been the program committee director for 6 years, the president for 4 years. So there's a long list of accomplishments for both of them, and it's my great pleasure to talk about him and introduce him to this panel. And I hope we learn a lot from him about how to contribute during this time. Thank you.
So let me start off with Krupa. Krupa, I just want you to give us a quick perspective and what are you seeing in the hospitals? How bad is the disease? Are we seeing the numbers going down? Where are we in Lehigh Valley?
Thank you, Dr. Singh. Thank you for having me today to talk about this important topic. I know we're seeing a lot of things in the news, and we're seeing different information about COVID numbers rising and lockdown and things. I think the Lehigh Valley was hard hit by this pandemic. Because of our proximity to New York City, we saw some cases pretty early on in the pandemic, and it actually started in the Pocono campus where I work, and then kind of spread down into the Lehigh County, Northampton area, and we definitely have a higher population there. So raw numbers wise, we've definitely seen a very high number of cases. Initially, we did have some very sick patients, and you know, some of them did badly because as this all was going on, we didn't have a great idea on how best to treat these patients, as it was a new virus, and we don't have any type of immunity to it, and it was kind of behaving a little differently than similar viruses we had seen in the past. And being in this sort of country where our healthcare system is structured to provide such good care for the individual patient, we weren't the most equipped to handle the sort of like natural disaster type situation, and kind of the public health and knowledge sharing component of how we handled this may be less organized than other areas of the world. But I think that as we are moving on, we've definitely have made progress in terms of understanding how to better treat this disease, and how to really handle some of the complications that go with it. I think the social distancing methods have certainly, you know, kind of dampered the curve, so we're not seeing the same onslaught in the hospital. You know, we are learning, and I think that we will be able to handle this, and hopefully we'll have more evidence to back up the better treatment that we are implementing now, and hopefully in a year or so we will have a vaccine to prevent the disease. And I think this has actually been a great learning experience for all of us in how to innovate and quickly implement strategies to combat emerging diseases. So, you know, with all of the negativity, I think there have been a lot of good things that have come from this as well.
Very good. And Dr. Shah, I just have a quick question, because I know you have been a very difficult spot in terms of dealing with mental health issues. What is your take on that?
I just wanted to thank you and IAALV to have me here, always include, and thank you for your kind introduction. So answer to your question is that, yes, we have seen what's called a mental health drift. A lot of people, especially initially when COVID started, a lot of hospital beds were utilized for COVID patients, and there was a lot of improvisation. I currently am working in an inpatient addiction rehab facility, and we have seen and we are seeing a lot of mentally ill patients there in these facilities, and perhaps jails are facing the same thing versus them being in the hospitals. So what the biggest impact that people are having, especially with mental health and other people who are facing some serious mental health issues is that they don't have regular resources. For example, outpatient partial hospitalization programs, they totally shut down initially, and Zoom meetings are not as effective. Addiction is on the rise because they don't have their sponsors, and also the regular people who, I would not say that the diagnosis of addiction would apply, but definitely a higher risk. And similarly with the mental health issues like depression, anxiety, with what all we are facing, it's a very high risk in all of us as public, service people, like either in medical field or yoga teachers. I think that that's something that we all need to have high awareness of, that people might not be even sharing. A lot of people have lost their jobs. Staying at home is not a lifestyle of a lot of us. Kids are home, so mental abuse for children, physical abuse, domestic violence, those are the issues that we are seeing at rise.
Krupa, let's just talk about some common questions that I get, and I have personally seen a lot of patients with COVID, but again, I don't see the very sick patients because we turf them to you to hospitals, but I do see a lot of the questions come to me from the community. Some of the questions I have been asked, about the treatment options, like where are we in terms of treatment, outpatient, and when people are in the hospital setting. So can you talk a little bit about the treatment options that we have at the moment as compared to where we were 4 months ago?
Sure. Okay. So if we go back to the first patient I actually saw with COVID was on March 7th in our Pocono campus, and it was a little cluster that we had kind of traced to a local church, and we saw many patients from that group. Actually, we didn't give them any treatment, but because this was before the studies with hydroxychloroquine had been known, and before any real guidance was offered as far as treatment. So we just gave them supplemental oxygen because their oxygen levels were low, and as they required less of it, we sent them home. If you look at their CAT scans, they look like they had horrible pneumonia, and you would think they would be much more sick. But as the virus spread, we saw an increasing population in the hospital, and there were more people infected with these predisposing risk factors for severe disease. And I think it was at that point where we saw so many people that we tried to do the best for, because they were not that old, diabetics, people in their mid 30s to early 60s. We wanted to do the best we could for them. And the treatment options we had then, there was a point when hydroxychloroquine alone became popular, and then we started combining hydroxychloroquine and azithromycin, and really supplemental oxygen prone positioning, where we have people lay on their belly. It's supposed to help oxygen get to the lungs better. Those were the main treatments we were using for a while. And by the time, if they needed to go to the ICU, we would have to give them treatment as in any very sick patient who developed sepsis, where the inflammatory response to an infection becomes so severe that they have trouble breathing on their own, maintaining their blood pressure, things of that nature. We were doing that in the ICU setting, but we didn't have any direct treatment for the virus itself. During this period too, we had outbreaks in assisted living facilities, the nursing home settings, and those were kind of hard because you're bringing in these patients, and they have so many other comorbid conditions, and there was very little we could do for them. And the question was how much of this we can handle, because once it gets into one of those facilities, almost everybody has them. And as we were kind of progressing in this pandemic, there was an organized effort from the network following CDC guidelines, WHO guidelines, and nationally, various hospital systems are putting together treatment recommendations because usually we look towards professional societies and clinical data to guide our decision making in medicine these days. That's evidence-based medicine, but the difficult situation here was that we didn't have good evidence to guide our treatment. So it was definitely a organized effort from Lehigh Valley Health Network to kind of guide the clinicians on how to handle these patients. And, you know, I think our overall numbers in terms of positivity are going up. We do have more testing available, so that could play somewhat of a role in it. But I think we are being more effective in early intervention, the quarantining and isolating of positive patients, and you know, social distancing, hand hygiene methods and things. And we're definitely seeing less critically ill patients. And pretty recently, actually, we've had some trials come out for some treatments that do have decreased mortality. The recovery trial out of Oxford has been very helpful and has proved a significant decrease in mortality for patients requiring supplemental oxygen with the use of a common steroid called dexamethasone, which is widely available and cheap, and we know the side effects of it. So that has been wonderful. The state is allocating remdesivir for us. And we've had good access to the drug. We've had trials done, randomized trials that show decrease in the length of illness for patients when this is given early in the treatment course. So we are using that as well. You know, I think that's what the state we are now as far as treatment. Those are the options we have. We also have convalescent plasma, which is also an organized national effort. It is being done as a study run out of the Mayo Clinic, and we have supplies of it and we have funding for it. And that is a treatment that is giving the plasma from patients who have recovered from COVID and hoping that the antibodies in that plasma will help the patient fight the infection. So those are really the main treatments we have available right now for people that are requiring hospitalization for COVID infection. There are the vast majority of people that contract COVID-19 will have very mild symptoms. I saw a number, I think about like 5% of people that contract the disease with the numbers that we have now, understanding that we are under testing. We don't have enough supplies to test everybody. So even with the availability of testing, we see that 5% of people will end up hospitalized. Most people that acquire it will have mild symptoms and will be able to handle their symptoms at home. So I think that's where we are in the state of treatment.
Thank you, Dr. Daniel. So that's very helpful. So we are definitely in better shape as compared to where we were in the beginning of March and now.
Yes, definitely. I feel more hopeful in terms of how to treat critically ill patients. And I think the social distancing and the hand hygiene and all of those interventions that we're taking on the public health level are helping.
And quick question, what is the recovery rate? Because that's a very critical number to me and in general to patients and people, but I don't see that being talked a lot. So if just give us a quick update on the recovery percentage or rate.
So like I said before, with the active, the diagnosed cases, about 5% of people will end up in the hospital. And out of that 5%, I believe it's about 20% that will end up in the intensive care unit. Again, that's another smaller number. And the mortality rate calculated from national data has been about 40% for patients that end up in the ICU. So people that get that sick, that is a very high mortality rate. But that most of these numbers are from before we had these new trials regarding that can actually help with improving mortality. So I think that will go down as well. We have better understandings of how to properly ventilate these patients and give them blood pressure support and prevent clotting complications and things now too. So we definitely have made progress in how to handle certain complications associated with the disease in the critically ill. So I think that number should continue to grow.
Yeah, so I was, Pennsylvania's recovery rate is over 70%. So that to me is very reassuring. And I don't know if you agree with that.
I do agree with that, actually. And then also, I think that things are kind of, we don't have a good perspective of it because we really don't know how many people are positive. So if we really tested everybody, we would see that it's really a very small percentage of people that have serious complications from the disease. And I think we also need to keep in perspective, part of the social distancing and these interventions has been so that the hospitals will not be overwhelmed. So it's not so that no one will ever be exposed to the disease or get it. It's just that if people get the disease, that it will be timed in a way that we can handle the burden onto the healthcare infrastructure. So I think that kind of understanding why we're doing it also adds to I think it will take away from some of the fear that's associated with it. It's not the end of the world if you get COVID. You will most likely be fine. And we're trying to limit the people that get it at the same time so that we can give the best care possible.
Sure. And another, on my observation, I've had some families where, say, one or two family members got COVID, and this is again beginning of March. And families were really panicking. They were very scared that how do we manage this situation? And, in the Asian setting, sometimes there are 3-4 generations living in the same household. And obviously at that point, I didn't know how to answer that question. And we just took a leap of faith and we said, okay, we'll just see whatever happens. And now we are in end of July, and I'm very happy to share this, that in these family settings, those 2 people who had COVID infection, they were sick, hospitalized, and the rest of the family members, that includes kids also, nobody tested positive. So how do you explain that even in the same household, 2 people are very sick and the rest of the family members don't get anything?
So I should stop muting myself. So I think explaining some of the mechanisms of transmission will help explain how the rest of the family did not contract the disease. So how we understand transmission of COVID-19 is through droplet means. That means if someone coughs or sneezes or releases some secretions, the virus will disseminate into particles into the air. And most of the particles that will leave the person are droplet particles, meaning that they are greater than 5 microns, and they will travel a distance of 3 to 6 feet, and they will fall to the ground quickly. If you are not wearing a mask and you're standing close to a person that has COVID-19 in the infectious state and coughs and sneezes, and you inhale this droplet, or it lands on your hands and you touch your eyes or rub your nose, and you have enough of that virus inhaled, that was how you will contract COVID-19. If you stay the distance and wear a mask, you probably will not contract the disease. There are some theories about airborne transmission of the disease, and that is also highly controversial, but I think that the close contacts not contracting the disease is good evidence that this is not primarily an airborne disease. When someone coughs or sneezes, the majority of the particles will be large particles greater than 5 microns that will fall to the floor quickly, but a few particles will form that are less than 5 microns. And when the particles are smaller, they can travel further and remain in the air for a greater amount of time, up to 3 hours. Now, if a person is exposed to this airborne particle, how long they are exposed and how much of the airborne particle or the size of the viral content in that particle also affects if a person will contract the disease. So if you do not spend a lot of time with the person, they're isolated in a room by themselves, you're not going to be exposed long enough to these particles to contract the disease. Also, frequent cleaning of non-porous surfaces. We know that the virus can live on non-porous surfaces for a long time, up to 72 hours. So non-porous surface would be like stainless steel, and porous surfaces would be like something like cardboard packaging. It lives much less long on porous surfaces. You know, if we make contact with this, we want to wash our hands before touching our face, we just want to be conscious of it. So these measures are very effective, and actually close contacts are the most likely to contract illness from a COVID positive person. And even that rate with the numbers we have is low. I saw recently something like 5%. So even if a lot of people in our community have COVID-19, if we're doing the proper social distancing, this is why we walk further from people and we don't talk for a long time and we do not gather for parties and you know, sit at a big table together. These things are effective to prevent transmission, even when a person has disease. The CDC recently released a case study of a hairdresser that had COVID-19, and she masked, and I forget the exact number of people she saw, but only 2 people got disease from having been serviced by this hairdresser when she was highly infectious. So if we follow these preventative mechanisms, it is very effective in preventing the disease.
Thank you, Krupa. Can you also discuss about close contact? Because I get that question a lot from patients, so I just need a clarification on that.
So close contact.
What's the time, and you know, how long do you need to be in contact with somebody to actually get infection if somebody is in the acute infectious state?
Okay, so we don't have any clear data to say you can be with a person for this much time, but the knowledge that you need a certain amount of the virus to contact your mucous surfaces to get the infection is very useful. So if someone in your household has COVID-19, they should be isolated into a room by themselves. They should use their own separate bathroom if possible. I know in some situations it is not possible. So just limit your interactions with them. Don't have them prepare food, just bring everything to them, and have them use separate towels, and all those types of measures I think should be pretty effective. There is some theories that there is fomite transmission of the disease, meaning, you know, like I said again, on if the virus is on a high contact surface like a doorknob or a desk or things like that, there is a possibility that you can get transmission. That's why we clean high contact surfaces frequently, and a lot of extra things in our environment, we want to put them away so that it's less of an area for the virus to stick to. But even if this transmission is possible, we know that as time goes on, the virus, its ability to infect decreases tremendously, because the virus does not, the whole amount of the virus that lands on that object does not live the entire time. So the active virus count is going to drop quickly, and that plays a big role in causing infection. So even if you are exposed to a small amount of the virus, you may not get the infection from it.
Thank you, Krupa. I'm going to give you some break now. So I'll I'll have Dr. Shah answer some of our questions again. Dr. Shah, we've seen a lot of social isolation in these times, and it's been very, very difficult on patients. I have seen that in my practice, and as a primary care physician, I have to deal with those situations a lot. I just want your opinion on what should I be telling my patients, and what would you be telling the families in general?
Thank you, Vasu. So, you use the term social isolation rightly. We are calling it social distancing, but it is really social isolation for our patients and for all of us. What it's caused by a lack of physical interaction, which plays a lot, which used to play a lot of positive roles in our life. And now we are seeing the deficiency of that, whether it's our work, home, relationships, kids going out for play dates, it's lack of schooling and on one-on-one basis. So even kids who said didn't like school are now realizing how. So social isolation is coming to a point where everybody has to realize that we have it, but everybody also has to realize that it's not here forever. However, as it's panning out, we are realizing that it might be here for a little bit longer. So patience is the game, and just telling everybody not giving them false hopes, and all the people in this group will agree, it's not false hope, it's just we do not know the time period of how long it's going to extend. So just making people aware of that, yes, there are things that you have lost, but everybody has lost. Simple things like going to movie theater or going to a Super Bowl party, stuff like that. But also then I tell all my patients and family members and whoever is asking me is that be very present to what is thrown at us. We are not I am a psychiatrist, but I'm not an infectious disease doctor. So if I need that source, either I'll go to a authentic source of that, or I'll ask my doctor. So rationing our media exposure to not more than 10 minutes a day, I really think that's very important, because it's like a circus out there and we don't know what information is correct. Another alarming thing is that our kids are a lot on social media and TikTok, and for them the biggest source of news is TikTok. So we can't confront them because they're already going through a lot, but first of all, hearing them out fully and then approaching them very gently, kind of yielding and understanding, and then giving them guidance. And if you don't know, like for example, my daughter, if she is freaking out about, I let her talk to her family physician and clear certain things. She hears her better than me in certain regards. And also stay away from the things like you said you have so much good, and we were child, it wasn't even there, because they don't know what was there and not. Their reality was different, and it's totally shattered right now, talking about kids right now. But like coming to adults, all of us and some of us are lucky that didn't lose jobs, some of us did lose jobs. So those of us who are doing work and able to work from home, or it's a blessing. And I always say that blessing conversation kind of make people defending themselves. So I call it count your inventory, what's left. Physical exercise, very important. Yoga, as we talked about earlier, and meditation, very important. Whatever our spiritual strength is, let it be we all have different spiritual backgrounds, and it's very important that we go back to the source every day and almost make schedule, because our schedule is so disturbed, for what we are used to and take for granted. So now getting up at 5 a.m. for a lot of us is like, so you have to remind yourself to do that. Be very aware of diet. What we are jokingly saying is that 15 pounds COVID weight gain, everybody is facing that. And after a dip, everybody has to realize that we have to do a little bit of transition in that. Also, talk to family, talk to friends, and be quick to ask for help, because we are not immune to mental illnesses, as talked earlier. We are not immune to addiction. So, but if we are seeing a change in behavior, if I am sleeping 10 hours a day versus 5 hours before, recognize that. And I think all of us in different fields can make an effort to educate people and make it a point. And for example, you, Vasu, that go over certain things, even if they're not sharing. Are you sleeping okay? Is something bothering you? How are things with kids? Which we typically don't ask the psychosocial questions as much, but make it our point to find out, because a lot of people are also they would not ask for help because in their mind, they're quote unquote normal. They should be able to handle this. Um, Another thing that I'm learning about COVID is the stigma that I'm seeing that more in Southeast Asian families than American. But if one person of the family is COVID, they're not telling that. And that's also dangerous that they're invited somewhere to, so educating people and that it's not, it's not the same as AIDS, for example. So to make people see that not, and it's our part, I think, to educate them. They're not getting all that education is social media and news, which is alarming. That's dangerously alarming. So those are the few pointers that I would give.
I have another quick question for you, Dr. Shah. What is your advice to the professional community, people on the front lines? It could be people who are working in the grocery stores, people in the hospitals, or police department people, or anybody who's on the front line, because I have seen some severe burnout in people, and many of us, we think that, we can cope with any situation that we are thrown into, but I have seen some very esteemed member of the community that I've known for years, and I have revered them. And now all of a sudden I see these people going down the hill because they took up on a lot of stress. So what do you say to these people who are otherwise the pillars of the community, but they're going through a lot of stress?
So as I said earlier, do inventory, because unfortunately, all these people who are on front line, and maybe it was the situation like that, they did not get that kind of support from, whether it was medical community, whether it was the grocery workers, whether it was the police, that they would deserve because they were the front line. So I think they have to make their own communities and support each other. Also understand that the people who are dealing with, because they were always the caregivers. So who give the care to the caregiver? It's like the same analogy when there's a cancer patient and nobody's looking at the spouse for 2.5, 3 years, right? So they have to make their own groups. I think it's mine and your and our responsibility to create groups just for professionals. They're also facing a lot of frustration from other, giving help, being there, ignoring their families, putting themselves on danger, but the community they're serving is not as compassionate. And the employer is employing them. So they're in the middle of two bad choices, or, my advice to them is, and me and you're in the same boat, is that find your strength within yourself and within each other. And I do that a lot, and you know that. There is nothing wrong in saying that I can't see any more patients, and that's okay. And that's your breaking point. Take a couple of days off and learn yourself. Teach yourself to use that extra time to watch some silly Indian songs, or go play football with kids out in the field, or whatever your relaxation is. And some of the things that you don't do, try doing them. Take a hot bath. These are some things that all of us will say, I didn't do that because I didn't have time, or whatever the reason was. Acknowledge for yourself and other people that there is disappointment, but we are in a time of the world that none of us have seen in our lifetime. So I am disappointed in my employer or my government or my community, but around the world it's happening. We are from Pakistan and India, it's happening there. So who to turn to and say, you're having a good time while I'm going through that? Because everybody is facing it very hard ways. The people who are more aware and educated suffer more because they can see more. So give yourself some margin for that.
Thank you, Muniza Shah. Thank you so much. Mamta, maybe you want to jump in here and just give our viewers and what would you recommend to do?
Good morning once again. Thank you, Vasu and Asha, for giving me an introduction. Let me just tell you, I agree with what Dr. Shah was just talking about. It's more of doing a practice or bringing a discipline during this uncertainty time. Of what is happening all over the country, all over the globe. So it's more of understanding what yoga is. Yoga is not just getting into a pose. Yoga is about a practice. Basically, you practice and you understand what the nature of your body is asking for. You go within the body to see what the body really asks you for. So by doing yoga or making a discipline of your routine life, maybe just 15 minutes, maybe an hour, or maybe 45 minutes if you don't have too much time. But the breathing process in yoga helps you to get away from this kind of stress, the anxiety, and you begin to let go things around you. So when you begin to let go of small things don't matter to you, you begin to live in the present moment. You try to understand what are your priorities as of now. And yes, I would also like to discuss, there are various types of yoga, and I'll name a few which could help from a teenager to even an older couple or an older person. So Hatha yoga is something which is a very gentle based yoga. And that is more of stretching of your body with the moment of your breath into that stretching. And that is for people who are basically, very new to yoga, not able to go for long walks, not able to exercise. So this helps you to kind of be very subtle with your body, but understand your body. And then that's how you release the anxiety, you balance your mind. And I think, like Dr. Shah said, most of the kids, the high schoolers, are into social media. So I think I would suggest and recommend every little child to try it for a particular time and see if you gain out of it. And I'm 100% sure you would. I think I've benefited from it quite a bit for the last 15 years as I'm practicing yoga. Hatha yoga was for maybe the teenagers, maybe for old people who cannot, go into the depth of the poses. The second is vinyasa. Vinyasa or Ashtanga yoga is more of an intense yoga. It's more of going into pose after pose, and you are using your breath. So breath is the whole point in yoga, where you are able to control your breath, you control your mind, and you begin to live in that moment. And that's what I think as of now, everybody needs it. Another point I would like to bring is Nidra yoga. It's again what Dr. Shah was mentioning, people not sleeping well, lack of sleep, anxiety before sleeping, unable to sleep for 8 hours as they used to do it, right? So because you don't know what the future is holding, and you're trying to, and you're not able to sleep. So there's a yoga called Nidra yoga. Nidra itself means going to sleep. So that is performed generally during the evenings. And it is a process where you are into a guided meditation on the mat. So for people who cannot sit long during meditation, right, maybe even 5 minutes, but because of your knees, because of your neck, because of your shoulders, or maybe your hips. So what you do is you go to a Nidra yoga class where they make you lie on the yoga and guide you through a meditation with very few yoga poses in between, but at the end you are completely relaxed. So from the mind to the toe, you are just relaxed into that yoga pose. And I would recommend people who are really having sleep issues should try at least once and see the experience, feel the experience. You would come out more positive when you are out of a yoga class. Other thing is, let me tell you a few benefits of yoga. I told you some types of yoga where you can go, but the benefits are too many, right? I don't think so I'll even be able to complete it in this session. I can talk about yoga all the time. So basically, yoga helps you to reduce your stress levels. It goes way, way above, because you let go things so easily. You live in the present moment, and you realize that, it trains your body and mind to, observe self-observation, right? And you are then getting aware of the nature of your body. So that's what yoga does. And then as you balance your mind, you make better decisions in life, right? You are calmer when you are doing some poses where your mind is balanced and your breathing techniques are so inhale and exhale all the time that you try to get yourself very calm, very subtle, and you make better decisions in life. So yoga is something I should say, recommend that everybody should try it. And it's a medicine. It's a medicine by itself. It increases your immunity system. It decreases your disease because you are stretching your body, and you get to know where the limit of your body can be going. And then you try to fit yourself into that poses, and realizing that I don't have to do the pose, the complete pose. I have to be comfortable where I am. So that itself makes you as a person a very subtle person, and you are not kind of, having everything going around you, having the anxiety as to what is going to happen. So because you have understood what the nature is of the body. So that is, as of now, I can say what yoga does, and I would definitely recommend everyone to try yoga. It's not about just losing weight. People come to me, oh, am I going to lose weight in yoga? So yes, definitely you will if you practice. So yoga is not an overnight journey. It's a journey of learning, journey of an experience. It's a beautiful, blissful journey. So yes, I mean, during this COVID time, I would surely recommend that to increase your immunity. Your anxiety levels go down, your stress levels go down, your breathing becomes better. Meditation is one way of doing yoga. If you cannot go to classes, you can meditate wherever you are sitting right now. We can all do meditation. And if I get an opportunity, I would like to, just have a little experience of what meditation is with all of you, if you all are in with me. All right. So when we are sitting here, I'm going to just instruct you. When I raise my hand, you will say Om. All right, and I'll put my hand off. Again, when I raise my hand, you will say Om. So let's do this practice, okay? And let's see how you experience it. You may not experience it right away, but as you do it, you would know what I'm talking about. So let's just start with Om. You can keep your eyes open if you would like. Om.
Peaceful.
The purpose of not telling it for so long is the space that I have given for you to understand your mind. You start talking to your mind. Why isn't she saying anything? Right? You start connecting to your breath. This is a space that you get when you are directing yourself to hear from the other person. So you take a pause. You create a patience. You are very tempted to talk, but you say, no, it's not my turn. So that calms you down. That calms you automatically. My purpose of stopping there was not to end the thing. It was to make you realize I'm coming back, but you need to be silent. You need some silent space when you do something. So these are little things when you do meditation, and that's where you start knowing your inner self. And that's how yoga helps. And yes, you would get into poses as you keep practicing. That's for sure. It comes to you very naturally. So that's what I would say about yoga. And let me just end this talk. I don't know if I get a chance to talk about it. Accept what is, let go of what was, and have faith in what will be. That's what yoga talks about. Yoga is not to be performed, but yoga is to be lived. That is what yoga is. Namaste.
Thank you, Mamta. This was very helpful and very informative, and I'm sure there'll be many of us who will be calling you to help us out and how to get started.
Right.
Thank you again.
Thank you.
I'm gonna just have you answer a few questions. I just got some questions from the community. Dr. Krupa, she's a good friend of mine and also a colleague. She's watching us, and she has a question about the air conditioning, some environmental controls. Maybe you want to talk a little bit about that, if you have any information?
Sure. I think, there is, whenever we have a new infection, we take every precaution possible. We kind of overdo it in a lot of cases. And in some situations, like with the Ebola virus, it was necessary because it was a highly deadly virus. And
I'm sorry to interrupt. Can you read the question so that people know what we're talking about?
okay, sure. Let's see, so the question is, any talk of environmental controls like filters on ACs? I think there's a controversy surrounding UVC light due to ozone, but there is some existing technology that is showing promise. I think environmental controls on a larger scale are not receiving as much attention as it should. My response to that would be that if the virus is truly airborne, which I don't believe it is, I don't think that is the primary mechanism of transmission. If it was airborne, like measles or TB, I think the issues of the air filtration would be more relevant. But as we have any new emerging pathogen, we take over precautions to make sure that we're not missing anything. But we don't have really solid evidence that this is an airborne mechanism of transmission, or that's the primary issue. So I don't think that this will take off, really. I don't think that it's going to be really significant. I think our money and our effort should be invested in other forms of prevention and transmission, like the social distancing and masking, surgical masking, and things of that sort. UVC light, we do know that UV light does decontaminate many surfaces, and there are machines that produce UV light that are being used to disinfect N95 respirators for reuse because we had low supplies. But I am of the personal opinion that in most of these situations, an N95 is not necessary. It's actually very difficult to wear one of these things for an extended period of time. The primary function really of the N95 is to protect yourself from inhaling a very small particle. That's why it's fitted tightly around your face. It's just not functional to go extended periods of time wearing these masks. And even in hospital settings, for the average positive patient, we are not using N95 masks. We are being asked to wear them in patients' rooms where there are possibly aerosol producing procedures. And even the vast majority of these procedures will not produce significant aerosols to infect anybody. I don't think that talk on these sorts of interventions are going to be long-lived. But again, I'm not an expert on these technologies myself either, but I think in the context of what's happening, it's probably not going to be meaningful.
And another important question to both Dr. and Dr. Shah. And I'm not starting a war here, but I just want your opinion about the school opening, because that's a very big contentious issue right now, and people are very anxious about it. I personally, I'm okay to send my kids back to school full time based on the data that I have reviewed personally. But I just know that people have their own anxiety, they have their own fear. What do both of you think about that?
I can say my part in that is that I'm with you, Dr. Singh, when it comes, am I ready to send my kid to this school? Yes, because it's a catch-22 situation where if we are keeping the kids or people for too long at home, there are many, many consequences that would be unbearable and become perhaps as fatal as COVID is. And more research is coming out with the unknown answers to if the whole population was tested, what was going on. And when Dr. Krupa said about the droplet infection versus airborne, the education to that and how to handle that for people to understand that how to prevent the airborne infection versus droplet infection. And in schools too, that would be more important, and time, effort, and money by the governments and state level, and for us too, if that's spent on that, and also encouraging people to live a new lifestyle that we are walking into. Hopefully they will change back to how we were, but perhaps a lot of better things are coming out as spending family time, doing yoga. We're talking about all these things, taking our work more seriously. So the short answer, yes, I am in support of opening schools with cautious and new lifestyle.
Vasu, we have some questions. Shika, are you,
Yes.
can you unmute yourself, please? Yes.
So, hello. I have some questions from the general public. The first question is from our team member, Rajiv Barua. He's asking, is it okay to go to a restaurant or a beach, or is it safe to visit a medical facility during this time?
So I can answer this question. I don't see any problems with that as long as you know what you're doing. Going to the doctor's offices, and most doctor's offices are using all the precautions that they should. For example, in my office, I'm not bringing tons and loads of patients to the office. We have definitely made some arrangements. So we are bringing in patients in a very spaced timings. And we are using all the precautions that we should, and so are the patients. So I don't see that as a problem, because not going to the doctor's office and not getting your appropriate, medicines, testings, I think that puts you at a more risk. So I don't see that as a problem at all. Going to the beaches, yes, as long as you're, doing your social distancing, you're not in a very crowded place, I think that should be okay. But Krupa, you may want to add to the question.
Yes, thank you, Dr. Singh. So as far as social outings and things, I think it is okay as long as we're following the social distancing precautions like the CDC is advising. I think it's okay, and it's actually necessary. And I think it's actually a good thing that more of us are doing things outdoors and, active sort of things to keep engaged, rather than sitting indoors in front of a TV and, circulating this maybe contaminated air. I think that the things people are doing nowadays are better for them in terms of a overall health perspective. And, when we're in a well-ventilated area, and keeping our distance and wearing masks, and washing our hands frequently and being very conscious of what we touch, high contact surfaces and then our faces, there is minimal risk for transmitting COVID-19. So and if you need medical care, I have actually personally had several patients where they should have sought medical care much sooner, and they end up with some pretty debilitating conditions because they did not come into the hospital sooner. So if you're having a stroke, if you're having chest pain, a heart attack, you need to go into the ER, because COVID-19 is probably a lot less of a threat than this other more urgent condition. And actually, Dr. Singh, I'd like to answer your school opening question now as well. I think this is a good time to talk about COVID-19 in children. I'm not a pediatrician, I don't treat children, but with the available numbers as far as infection rates in kids, we know that generally to the infection, kids fight it very well. There is this new phenomenon that is being documented. I think there are about 200 cases of this multi-system inflammatory syndrome in children that have been reported in the United States. I think it's important to keep in perspective that there are these sort of post-infectious inflammatory syndromes that can arise from other infections, other viral infections, other bacterial infections. This is not something unheard of or something radically different than what happens in other infectious processes. And it is very rare. And from my knowledge, the treatment modalities that we have for similar inflammatory conditions that we have more experience with generally do treat the symptoms of this post and multi-system inflammatory condition very well. I think kids, if they do get COVID-19, in general, will do very well. There's very little mortality. I think the latest number was 0.4 deaths out of 1,000. And I know if you have a child, that's not reassuring, but the likelihood that a child that gets this infection will have any significant complication is very low. The trouble with kids getting infected is that they may become transmitters of the disease to their caretakers. So they might not be feeling horrible and they come home and maybe grandma or grandpa or mom or dad will contract the infection from them. That is something to think about, but you know, risk versus benefits. I think keeping kids out of school, out of these social interactions that are necessary for their development poses another risk. Hopefully we can restructure how schools are run, you know, maybe more outdoor time for the kids, maybe less time in front of a desk with these crowded classrooms. I think those would be better things to do than just canceling school altogether.
Thank you. So we're getting some Facebook Live questions. Raghwender Thakur, he asked, as per WHO's recent statement, they said that N95 masks are of no use in preventing of COVID-19. This has been informed to general public months after the pandemic occurred. What are the alternatives to cope up with this situation?
So I can answer this question. I think initially when any new pathogen, like I said before, becomes an issue, we are over precautious and we take maximum protective measures to kind of prevent spread and you know, learn more about the situation before, so we can handle it better. This is what happens when we have any new emerging pathogen. And it was reasonable initially to be overcautious, but as we know more, I think it's a reasonable thing to say that the primary mode of transmission is likely droplet transmission. We have data from other coronaviruses and other similar viral infections that consistently show droplet transmission. There was actually a study, I think it was done in 2007, published in CID. They did, it was a large group, and it was a randomized trial where they assessed the transmission risk of influenza versus coronaviruses, the more commonly circulating coronaviruses. And there was no difference in transmission among healthcare workers who wear a surgical mask versus an N95. So I am of the opinion that the N95s probably are not very useful, and it's kind of a burden on the healthcare workers to have to wear these masks for an extended period of time.
So Uttara Gachoskar asks, what are the natural mechanisms to build immunity against the virus? And she's also asking, are the public restrooms safe to use while you are on a long drive?
Well, to build natural immunity, you know, that's not really my area of expertise. I'm not aware of anything that can boost your immunity to the virus. We are hoping to develop a vaccine, hopefully in the next year or so, that can give us some immunity. I think something to highlight is that as we approach flu season, it is really important this year, more so than other years, that people get their flu vaccines, because we're really not sure what's going to happen with the circulating coronavirus, you know, and if people were to get influenza, you know, we have a significant surge in the hospital as well during influenza season. So we have patients that are COVID positive and influenza positive. It's going to add an extra strain onto the healthcare system. So I would advocate everyone to get their flu shot as soon as it is available. Public restrooms. Okay, so we do not have solid data that there is fecal oral transmission of the coronavirus. It is suggested that this could be a mode of transmission because we can detect the virus from stool samples, but we don't have any great evidence that this transmission happens. And again, getting the virus, you have to have the virus in contact with your mucosal surfaces for an extended period of time to contract the virus. So I think it is okay to use public restrooms. Just wash your hands right afterwards and be very conscious of touching your face.
Thank you. And this is, since we're running out of time, this would be the last question. And this comes from Srinivas Charya, and he's asking, what about the kids playing with the neighbor's kid? Is it safe to send your kids out to play with the other neighbor's kids?
I think it's okay to send your kids out to play. Again, the vast majority of kids, if they get this virus, will do very well. Be very conscious of them washing their hands and high contact surfaces. You want to educate them on not touching things unless they need to. I'm sure it's difficult with kids if you're sending them to a playground and things. Those surfaces are not cleaned very frequently, so it is possible that you can get transmission from these high contact surfaces. But I would encourage them to mask if possible, and then when they come inside, wash their hands very quickly. And the danger really in kids playing together, I think, is more for the adults than the kids themselves. So we have to weigh the risks of them missing these social interactions and these other outlets for themselves, and the risks of coronavirus, really more for the transmission risk to the adults that they are close to.
Okay, we can ask one last question, and that would be last question, I promise. This comes from Aparna Tamaskar, and she's asking, what is your opinion regarding universal antibody testing?
I think the antibody testing we have now is not sensitive enough to be accurate. I think it would be kind of a waste of our resources to invest in that at this point.
Yeah. I would just like to add on the antibody testings because some jobs are requiring that when their employees who were infected, when they return to work, they want them to be antibody tested. I don't understand the rationale, but again, if people are donating plasma, they need to have certain levels of antibodies, and I think then only you are allowed to donate plasma. And Krupa, you can correct me on that, but.
I do administer convalescent plasma under the Mayo Clinic investigation in the hospital. So my understanding is that they need a confirmed positive nasopharyngeal swab, and 2 to 4 weeks after recovery, they do accept plasma donations. I am not aware that they are quantifying the plasma for antibody levels. That may have changed because things are changing. We don't really have solid evidence that the antibodies formed are protective against the virus or help in the recovery process. It's just kind of hope. We have used convalescent plasma as early as 1918 in that, flu pandemic. And we have tried it for things like Ebola. And even in this situation, we don't have great evidence that it has any beneficial effect, but we know it's generally harmless. It won't hurt the patient. But there are nursing facilities and extended care facilities that are requiring COVID positive patients to clear their nasopharyngeal swabs before they will re-accept them for admission. And I can understand that the logic, because if a person that is actively transmitting does return to that facility, you're just, you're basically infecting your whole population. But I think it should be understood in the context that there is a very high level of false negatives in this type of testing. The nasopharyngeal swab, there is like between a 20 to 60% false negative rate. Not that the test itself is not accurate, but the sample collection is very important, and the timing of the sampling is also very important in obtaining a positive test. So if you take the test a day or two early, or you don't collect the sample properly, then you may have a false negative test and release a patient to spread the disease. So I don't know what the good answer is. I think antibody testing is probably going to be the least effective to prevent transmission of the disease, but nasopharyngeal swab testing is not, a solid answer either. I don't make those decisions in terms of like, clearing people like that. So, but I can't say what the best answer is, but the mechanisms we're using right now are flawed.
Yeah, and quick another update. I just want to bring that to your attention that there has been many patients or many people who were sick last fall or in November or December, and they were diagnosed with, say, acute viral syndromes. And now when we are testing COVID antibody in those patients from November, December, January, February, they're coming back positive. So my understanding is that the virus has been around since last fall, but it didn't really, because we didn't have the means to test and there was no awareness, it sort of we didn't really get to.
Yeah,
I agree that it didn't really happen in February, but it probably was there in last fall as well.
That is a strong possibility. Yeah, no, I remember hearing cases, of people with these non-specific viral syndromes having certain complications, which is possible. We have a certain level of immunity to the more commonly circulating viruses, but there are severe complications people can get from just any other viral infection. But yeah, it is very possible that this has been circulating much earlier than we realized. The first reported case was in Seattle. I believe it was January.
Yes, end of January.
But yeah,
so,
I agree with that.
Yeah, so if it's been circulating, that means that we, probably some of us already have some level of immunity, which we haven't really tested. Am I right? Or
it is, yes, that is true. But other coronaviruses, having immunity to that is not very long-lived. So we do know from the more common coronaviruses circulating, we can get reinfected as early as 90 days after another infection. So that kind of complicates the situation.
yes.
Vasu,
Thank you so much, ladies.
Yeah,
Thank you so much for your precious and valuable time. We actually have a lot other questions from Facebook users, but unfortunately we are running out of time. We promise you by end of this week, we'll post all the answers to your questions, but unfortunately we just have to move on. I'll just give the podium to Anita to just continue the program.
Yes, we would like to bring in Nitin Lad. Can you unmute him, please? Puran?
Yeah,
Nitin.
I unmuted myself.
Okay.
Can you hear me?
Yes, Nitin. Nitin, we'd like to hear from you the food drive you conducted right from the beginning. And I mean, you've been doing this for a very long time, but you are so passionate and you brought in more families to work with you. Can you please tell us a few things?
Sure. So to start with, I'm going to quote today's numbers, or rather yesterday's numbers from the CDC website. There are 4 million cases and approximately 144,000 dead so far. So now these are the numbers that we normally see. But the pandemic has caused a lot of other issues to people. To put that in perspective, children are affected. We talked about mental illness just now. So trauma for children, families are affected. People have lost jobs. I think the last number that I read somewhere was 40 million people have filed for unemployment. People have lost homes because they cannot pay their mortgages. Uh, People are living on the streets. So, as Anita said, I mean, I've been involved in the community for a long time. I've been running a lot of programs for the past several years. So, just being connected with such organizations, I became aware that these issues are real and actually they're growing. There are people, there are organizations that are running short of money to help such people affected by COVID. So one of the organizations that we have always been connected with is Allentown Rescue Mission, and Ashimda is here. So going back to a few years, Ashimda was the one that introduced me to Allentown Rescue Mission. This was like several years ago. And through that connection, the Indian American Youth Group, when it was formed around that time, the first initiative that the youth group did was with Allentown Rescue Mission. And we've been cooking and serving Indian food for all these past years, pretty much every couple months. So when I found out that organizations are getting affected, there are people who are in need. One of the organizations that I contacted was Allentown Rescue Mission, and they simply jumped to the offer when I asked them, is there anything that we can do to help you guys? I know as a youth group we cannot come and visit as usual, but is there anything that we can do from outside? And while talking, they asked us if we could provide them sandwiches, because remember, because of this COVID thing, they had also stopped their cooking in the kitchen. They didn't want people to congregate in the dining hall because of social distancing. So they needed some way of providing food, but kind of bagged lunches. So sandwiches came out of that, and I said, yeah, fine, let me see if people are ready to help. And you're not going to believe this. I mean, it started with a few families saying, yes, we will help. And over the course of a few weeks, it grew to 100-odd families who offered to help with sandwiches and a lot of other things like, chips and cookies and cakes and pastries and desserts and toiletries and things. And more importantly, this was an opportunity for people to be involved because, everybody was pretty much working from home. Children were at home, and there were a lot of children who got involved. Families came together and made sandwiches from home, and a bunch of people are right here in this, participating in this conversation here. But a lot more, and more importantly, children got involved. So we actually delivered 300 sandwiches 3 times a week for almost 8 weeks. And then, how long can you eat sandwiches, right? So eventually we changed over to hot meals. And since then, we have been providing hot meals every twice a week now for 40 people, cooking anything, like it can be chole and rice, pasta, meat, but giving them complete meal. And that has also helped Allentown Rescue Mission a lot. But just very recently, we were informed that the hot meals cannot be served anymore. New COVID regulations, or maybe enforcing the regulations that were already there. So no more home cooked meal to be provided. So, well, we'll find some other solution to that now. I mean, simply because people do want to help. And I think it's also a win-win situation. I mean, but we talked about, Mamta, you talked about yoga. Dr. Muniza, you talked about mental illness. Well, we simply started it with the idea to help. That's all. That was the main reason. But guess what happens, helping somebody helps yourself also. It's a way of keeping your mental well-being also good, I would say. You feel good that you did something for somebody. And we as human beings, we're all social animals, right? Everybody has been impacted. I just like sitting at home, doing nothing, because I've always been outside in the community doing something or the other. And it's just boring just sitting at home. So this has given me something to do while, my other activities are on hold. But I do have to thank all these, 100 or even more families that I don't even know now, because there are all these individual groups that help. And certainly have to thank Neha, who's the coordinator, who actually puts all these meals together when people contact her and tell her that they want to help. So it's her job, and she has all these, a huge list of people on WhatsApp that she communicates with. So as it stands currently, we are not serving any hot meals. That has ended. But we are looking for other alternatives, like we may provide just raw material, store-bought stuff is fine, restaurant-bought stuff is fine, but we do want to continue in some form or the other. We're not going to stop this. We are looking for alternatives. There are people who are already asking us, what can we do? We don't want to stop this. We want to continue it in some form or the other. So my advice to the community would be, find anything. There is a definite need outside. Just look for any organization that you can help. It doesn't have to be food. It can be anything. Just go out, talk, and if you need any help, I can certainly connect you to different organizations. Organizations that I know could use your help. Parkland Pantry is one. Second Harvest Food Bank is another one. Certainly there are lots of homeless shelters that are taking in people. There are other organizations that I can probably find for you if you want. And look for something that is closer to your community. You don't have to travel too far. There will be lots of them around. The religious organizations, I know Allentown Rescue Mission. It's an organization that has been in business for 100 odd years. They get so much food from so many different organizations. Just ask, and let's keep doing this, because as much as I know and as much as these experts have said, this is not going away right away. I'm at least prepared for this year, and from what I've been hearing, vaccine is not coming anytime soon. So let's
Nitin,
continue.
Thank you very much, Nitin.
You're very welcome.
Thanks for all your contribution, for you and to Neha also,
And the
and
many
to all
other
the hundreds of people who are helping,
Yes.
right?
Yes.
I'd like, I think Vasu, Dr. Vasu, you had some update for visitors from India?
Yeah, so I just have a quick update for families, friends, or any visitors who are visiting from India. If there is any problems and if people are running out of their medicines, they need to contact Indian Embassy in Washington. The embassy has started an it's an excellent program. They are working with a national organization called AAPI, which is Association of Indian Physicians of Indian Origin, based out of Chicago, National API. And Indian embassies is contacting National API members, and National API has assigned a team. They have one representative in each state. So wherever these families are, they need to contact the embassy, and the embassy will put them in touch with the doctors in their state. And these doctors are, they can write in prescriptions, or if there's any blood work that needs to be done or any medical needs, these state representatives, the physicians, will actually take care of it. So I'm representing Pennsylvania, and I have filled in or called in many people's prescriptions, blood work, etc. As all of you know, insulin is an extremely expensive medicine in the United States. So I have had some drug reps, and I'm just gonna name Dana Bender. She has helped me a lot. She has distributed hundreds of units of insulin to my office, and we have been able to distribute to some of the families visiting from India, and people actually drove from Philadelphia area to come and pick up the medicines. So my only request to families is that you don't have to live without medicines. If you don't have medicines, please reach out to your local organizations, because the problems of having not taking your treatment and then getting admitted to the hospital, medical bills will be much more expensive than to get the medicine. So reach out to National API, reach out to your local API chapters, or just contact Indian embassies. If anybody's in Pennsylvania, I'd be more than happy to call in refills and address their medical needs. Thank you.
Kapalbhati is a breathing technique that we use in yoga. So that's more of having a very strong exhales through the nose, and the inhales take place automatically. This helps the anxiety and the immunity system of your body. It increases the immunity system. So during this COVID time, I mean, people can practice this at their home using the Kapalbhati. That is, again, you exhale from the nose, strong exhales, and the inhale takes place automatically. You can Google and see, or you can, come back to me with any questions, write to me, shooting out an email to me at mamtamalik.com, and I'll be the most happiest person to help you out with that. Adding on to what Nitin had said, there's something called Kripalu Yoga, right? So Kripalu Yoga is also being compassionate. It's beyond the physical. It's beyond just doing the exercise. It's beyond going into a pose. It's making you more of a compassionate person towards every human being on earth. So I would say do everything that you can by being compassionate, and that itself gives you the pleasure. And you are trying to be happy by these little things that you do in your life. And I think that's the way the stress moves away from you, if somebody else smiles with your deeds in your life. So that's how I would say I would end this topic on yoga. So
Mamta, can I ask you a quick question before you?
Sure, Sika.
I do breathing exercises very religiously. What's the appropriate time? And I just follow YouTube videos.
Right.
What time should you be doing Kapalbhati? Some people say just do it for 30 minutes, 5 minutes.
Right. Okay, let me just go with this. Breathing exercises are the best when you do early mornings. All right, fresh outside if you can, if you have a backyard. If you don't, find a spot where you feel you are totally isolated from the surrounding, first of all right? And when you do the breathing exercise, you can start with minimum of 3 minutes. See how you do there, practice it for a week, and then keep increasing your timing. So that's how the breathing exercise actually works. It doesn't mean, oh, I have to do Kapalbhati maybe 50 times at the first go. So you lose the continuity once you do that. So the purpose of doing breathing exercise is to be very slow, understand your breath, and do it periodically. Like today I've done for 3 minutes, right? I continued that for a week, and then I extended for maybe 5 minutes. And you will see the difference that you can go up to maybe 10 minutes. And I have many people here who have done yoga with me in our community, and I do the breathing exercise of inhales, counting inhales and counting exhales, the same amount of inhaling and the same amount of exhaling. So you count it in your mind. And when you do that, you can increase again the number of counts while you inhale and while you exhale. So that's again a meditative pose. So I hope I answered your question, Shikha.
Yes, you did. Thank you.
Yeah, you're welcome, dear.
Well, Dr. Vasu, do you want to say anything to wrap up before Ashinda can do his vote of thanks?
No, Ashimji, please go ahead. I just want to thank everybody for being so patient, because I think we've gone way past our scheduled time. So thank you all.
I really wish we had more time to talk. This is very informative, and Dr. Muniza had to leave. I had so many questions for her. Maybe I'll put it on our webpage, and everybody else can do that. Go to IAALV webpage, put in your questions, and Dr. Vasu will be kind to answer those questions, I think.
So Anita, before, I'm sorry to just
Sorry,
jump
Firuze,
right
go
back.
ahead.
No, go ahead. Please go ahead.
I apologize, but I quickly wanted to, because we have been talking about kids' mental health and how to keep them active. As everybody know that since this whole thing started, we have been doing lessons on Zoom, and it has been working out really good. I was really nervous how it's going to all work out, but seeing the enthusiasm in the kids, like looking forward to do some activities, they've all been like so particular and so on time, looking forward to seeing their friends and dancing. So my thing is that we all should encourage them to be more active, participate in as many dance programs or meeting friends. Like, I mean, I'm struggling right now if I want to start an in-person class, because a lot of parents are like really struggling with the whole idea if they want to send their kids to dance classes, have in-person and studio lessons. So I forwarded this session to all my students' parents, and I hope they all are watching so that they get a better idea about how to move forward in coming months. So this whole session was amazing, and I would encourage all the parents to encourage their kids to even martial art or any kind of dance forms, to encourage them to continue, even if it's on Zoom, because it's very important for mental health for kids. That's all. Thank you.
Well, thank you. I haven't spoken a word in last 5 months, so I'll try to speak some words today. And I've been inside the house in this devastating COVID-19. I'd like to express my sincere thanks on behalf of IAALV to the panel members for giving an excellent coverage and insight into COVID-19. I'm happy to learn that we have started understanding the disease more and better than before, and now how to deal with it and avoid getting it. So a lot of things have been covered, and I wish we would have continued more, because there's so much information has to be learned and known. But let me say for Nitin, something Nitin said, that kudos to IAALV under the leadership of Nitin for providing so much services in the local area, so much needed services, and the selfless acts of many Lehigh Valley Indian, literally hundreds, who have shown to one another and a broader community during these difficult times, the love and affection and the service. Folks, disasters and crises bring out the best in us. I'm confident that in these trying times, the best of humanity will rise. Thanks to IAALV Program Director Anita Baru and other members of IAALV team for bringing the COVID-19 open session to us. Thank you for the panelists and Dr. Vasu Singh for moderating it so nicely. I want to, in the concluding, I want to say a few words. I want to take this moment when we are talking COVID-19 to pay tribute to all those working in the front line including the healthcare system, the people in the healthcare system, and those who are researching relentlessly around the world to find therapeutics and vaccines. Some hopes are there the vaccine will be available end of the year. And we heard a lot about the therapeutics, the development in therapeutics. So I hope they are available to us quicker. And I want to then finish it with few words from FDR. He said, the only thing we have to fear is the fear itself, our 32nd president. And then a Tagore's poem, which kind of suits this current state of affairs. Let me not pray to be sheltered from dangers, but to be fearless in facing them. Let me not beg for the stealing of my heart and pain, but to give me the heart to conquer it. Thank you. Thank you all.